All right, so this is the first in a series of informational webinars where Healthcare for All Oregon seeks to discuss the universal healthcare movement through the lens of an issue, a constituency, or another topic. And for those of you who may be new to our organization, Healthcare for All Oregon, HCAO as we call ourselves, is a 501c3 nonprofit organization who educates about and advocates for an equitable, affordable, comprehensive, high quality, publicly funded universal healthcare system that will improve the lives of individuals, families, and communities across Oregon and throughout the United States. We really do believe that if Oregon can be the first, and we're on track to be the first, that other states will follow that model. We're really excited to have this first webinar. We wanted to begin with the labor movement as our first theme for the webinar, as our roots lie within the labor movement, and because we know that the path to universal healthcare, a universal healthcare plan, is dependent on the support of unions and working families across our state. So we're so excited to have this fantastic panel tonight. We're going to be hearing opening remarks in a minute here from Lou Sinniger, chair of the Healthcare for All Oregon Lane County chapter. And Lou's a strong union advocate and lifelong, and as an AFSCME retiree. You're going to be hearing from Michael Lighty, president of Healthy California Now, who's also done great work with National Nurses United and advises Bernie Sanders on health policy. He's also an Oregon native from Eugene, which is pretty cool. Roach, chair of Healthcare for All Minnesota, and if that wasn't enough, the national coordinator for the labor campaign for single payer. We have Todd Farris, a Beaverton educator and OEA member, who's also a strong union advocate. And you're going to hear from Kaleigh Roehl, a registered nurse, a steward at Oregon Nurses Association, and get this, co-chair for the Democratic Socialists of America Portland chapter's Family Agenda campaign. So we're going to spend the first 35 minutes or so hearing from our speakers. And then after that, we'll move into a discussion Q&A, which will be your opportunity to share your thoughts, ask your questions. I will be prioritizing union members first, so please do rename yourself or let us know that you're a union member when you raise your hand. You'll be able to raise your hand at the end, ask a question, or you can drop them in the chat at any time during the webinar. I'll try to keep an eye on it if I can and pull those up. We're going to work to ensure your questions are answered. And again, prioritizing our union members in attendance first. So without further ado, let me hand it off to Lou Sinniger, that is. Go ahead, Lou.
Hey, thank you very much, Valdez. Wow, this is a great gathering. I'm telling you, this is we're getting a lot stronger as we go. Special welcome to Healthy California Now and also Labor Campaign for Single Payer. I just want to go down the memory lane a little bit. I first got started in the labor movement as a federal employee in 1978, organized the first uh, union out west with Bureau of Land Management. And I became a union representative after doing that in National Federation of Federal Employees. So the federal system does not allow, you know, federal employees to bargain wages or benefits. It's a sin, but it's a sin that's been going on for long years. Um, I wanted to mention that um, I finally changed out of that union and became part of Oregon School Employees Association, and then followed by joining AFSCME. And I worked for AFSCME for 20 years, organizing and doing a pretty good job. Um, what happened with healthcare was about in the 90s, I started to see how it was weaponized. You know, employers began to use healthcare as a leverage at the bargaining table. And I watched my bargaining teams, I mean, I was representing like, I don't know, 10 cities, a couple of counties, right? And I watched my bargaining teams when we went to the table give up, actually I mean, we would be in caucus, right? And they would give up wages, some rights even, just to maintain their health care through an insurance company that they had no control over. I mean, so anyway, um, the sad thing is that when you look at it, public employers And also private employers are caught in the middle. Uh, they cannot control what health insurance companies are doing. They cannot control the budget from one year to the next because health insurance companies demands whatever they need. I remember one time I was in a labor management committee. I'm sure many of you have been in these types of committees where this one was the healthcare committee. And here came in the insurance company that the city had made a contract with. And he was saying, oh boy, this is tough times. We're going to have to increase the premium costs or cut back on benefits. And uh, a summary of expenses, right? How much they'd received for premiums, how much they'd spent out. And I went to the bottom line, like all of you know how to do, right? And I looked at it and it was like over 15% was left over. I said, well, that looks pretty good to me. That looks like we're in Fat City. He said, no, that's administrative expenses. And we can't afford to give those up. Of course not. And we all know by now they couldn't afford it because that's where their profits come from. So upon retirement, I remembered that. And when Vermont sent a delegation of people out to Oregon, uh, I caught the bug and I've been working on this ever since. It's been about 12 years now or so. The problem is the problem is that the weaponization of healthcare it's wrong. It's anti-humane. And that's what we have to point out. We have to get over this hump. In Oregon, we have hundreds of volunteers and some good staff too. These people are heroes. We need what we need, and I hope this program helps do this. What we need is for the unions to grab this movement and take it on as their own. Um, I had a meeting one time, John Thompson from EU, he's an international representative. He got on the union caucus line with us one time, and he said the only way we will get single payer universal health care is when the unions unite and get behind it. And so with that final comment, I'm really looking forward to hearing from our panel and our questions raised by our participants. Thank you all for joining us.
All right. Thank you so much, Lou. We really appreciate your leadership throughout the history of HCAO. He's a former HCAO president. He leads every day down in Ducktown, Eugene. Thank you so much, Lou. Now taking us to kind of kick off the conversation with our panelists, hand it over to Michael Lighty.
All right, thank you, Valdez, and what a treat, Lou, to follow you and continue to be inspired by your work and commitment. Of course, you speaking from Eugene is a soft spot for me, and it's always great to. I always like to say fellow Oregonians, but really, my family would have my head because I've lived in California for so long. But can't give it up. And I do think it is very significant that HCAO is having such success in Oregon and really providing a model for the country. And I had the pleasure of being at your annual meeting and also continuing to be in dialogue with you and those folks who are working through the Universal Healthcare Governance Board to design a single payer system for Oregon. It's just tremendously significant. And you all will love this. I grew up in Oregon where we had the slogan, "Don't Californicate Oregon." I don't know if you guys remember that. But now California is really learning from Oregon, particularly when it comes to a lot of the detail work and really impressive technical work that's going on through the governance board process. But honestly, what that speaks to is how this is our moment. And we are meeting at a time when the government is shut down, essentially over the question of How do we help people in the U.S. pay for unaffordable health care? And the Republicans kind of admitted they don't have an answer. They don't really have, they don't really have a plan. They have a concept of a plan. Oh, they have a secret plan. Oh, yeah, we're going to deal with healthcare. But honestly, they're clueless, right? And the Democratic leadership plan is, hey, I've got an idea. How about we give more taxpayer money to insurance companies so that we'll keep the premiums a little bit lower? And that's it. And, we should fund Medicaid, but not too much. It's like the Democrats have been in power. They didn't truly, fund Medicaid well. And so they really don't have a systematic reform that is going to make healthcare cost less and guarantee it to everybody. And so, hey, it turns out we have that answer. And it turns out every other country like the U.S. has already figured it out. Who knew, right? It's really, I understand, health policy. We always talk about how complicated it is. But in some ways, it's not that complicated, right? Is that if you eliminate all the administrative waste and you essentially take the monies that we're currently spending as premiums, either employers or individuals, it turns out we can spend a lot less. The Congressional Budget Office says $650 billion less, and provide health care to everybody because we pay providers directly and we let providers make the medical decisions that they are educated to make. So in that sense, quite straightforward. But what we have instead is we have 60,000 people a year dying because they can't get the health care they need. We have, despite spending double or more than every other country, we have 85 million Americans who are underinsured or uninsured. 500,000 go bankrupt every year. 1 out of 4 patients can't afford their medicines that their supposedly insurance is covering. And of course, the rational function of an insurance healthcare system, rather, is not to make insurance companies rich, but to provide healthcare to people, based on what we need. And that is, every other country literally has figured that out. There are not for-profit insurance companies in other countries. There aren't the kind of $7,000, $8,000, $10,000 deductibles. They don't exist. Medical debt doesn't exist. And so we can, this is the worst kind of American exceptionalism. But the reason that our moment is now as well is because things are really bad, And there was a new poll that came out today from this organization, Undue Medical Debt, which found that 69% of voters believe that healthcare is not affordable today. 35% have medical debt. A good chunk of them have gone without food in order to pay for healthcare. And what's really remarkable for our discussion tonight is that these voters believe that insurance shouldn't be tied to employment. That 74% of the people in this survey said that agree with this statement that, if I can find it here, 76% of voters said they agreed with the statement. We need to switch to a different system of health insurance where people can change jobs or become self-employed without and not have to worry about losing their health care. That really is it. People say, oh, it's not politically viable. Well, except that 76% of people believe that it shouldn't be tied to employment, and we should have a system, that the government ensures that we get the health care we need. And that's consistent with a lot of polling. But what is also true about all these other countries who have national healthcare systems is that they were never achieved without labor leadership. It's just what Lou said, that this will happen when labor takes it on as a priority. Not like, oh yeah, healthcare is one of the issues we deal with, but actually makes it a top priority for the labor movement as a whole. And I spent, as Valdez mentioned, 25 years with California Nurses Association and National Nurses United, and helped start the labor campaign for single payer. And I, have worked on state single payer bills and federal Medicare for all. I've talked to union members and union leadership, Taft-Hartley Trust Fund administrators, Taft-Hartley Fund union representatives, and with the same message: this system is not sustainable. They know it, but they can't see their way out of a system that has been so deeply ingrained into our union culture, into expectations about what it takes to organize workers. And yet at this point, we are in an existential moment that healthcare has become so unaffordable that the only way workers are really going to get a substantially higher standard of living is to get rid of the insurance companies and go to Medicare for all. And we saw this in a recent study. The Kaiser Family Foundation does their annual or semi-annual employer survey. Average cost for employer family premiums, $26,993. Let's call it $27,000. Of that, workers are paying $7,000. So guess what happens when you go to single payer? You cut that down radically, and those savings go into your pocket as a wage increase. And others will be talking about this as well. But the savings from Medicare for all is the raise workers need, and it's the way that we control costs. And the Republicans and the Democratic leadership do not have the answer that we have, and we have got to seize this moment to put that forward. Now, the other, the other thing I want to say, though, is that it's not simply a matter of convincing, labor leadership that this is the right policy. I think actually most of them know it. When I've gone around the country talking to labor folks, local labor leadership who actually do the bargaining, heads of locals and stewards, they get it. You don't have to convince them. They get it. So how do we get from here to there, right? When people know it's the right thing to do, it's going to take a movement. And we are in a movement moment. It's not enough to be part of the resistance. And I'm not going to lecture the Portlanders about how to resist the fascist regime, because you all know very well how to do it. But we also have to move beyond that to building a movement around the demands that our government actually meet the needs of the people. And that is, well, believe it or not, most people expect government to do that. They might be cynical about its ability to do so, but the same reason we have to build this movement is because that's the only way we're going to organize people into unions at scale. We can throw hundreds, hundreds of millions of dollars at that, but without a movement that says, yeah, I'm going to join a union and that's how I'm going to take on the boss, which was very much the case in the 1930s. It's the movement that drives that level, that scale of organizing. Similarly, to win broad justice reform, including living wage and a green transition, public sector job creation, social housing that can end the crisis of the unhoused, protections against technology displacement. Those things we're not going to win these things piecemeal or individually. We're going to win them as part of this broad upsurge, movement upsurge demanding the social and economic justice. And at the heart of that is Medicare for all. And at the heart of that is the labor movement. Because the labor movement historically has been the vehicle for economic justice in this country. And this is the economic justice issue of our time as part of this broader movement agenda that will actually let us reclaim our humanity, our dignity, and our sense of power. What we're facing now, of course, is an oligarchy where a few wealthy individuals, one individual, Elon Musk, has more wealth or as much wealth as 52% of Americans. There's just a handful of billionaires that had the 1% that have as much wealth as the 93% of the bottom 93% of Americans. That oligarchy can't stand. We have to fight and destroy that oligarchy in order to win the economic and social justice. And the way to do it is to talk about the personal impact of that oligarchy. And the way it comes down, in some ways, the hardest is in terms of healthcare. That oligarchy, that set of power relations, those insurance companies are denying us the healthcare we need. They're killing us, and they're denying us our humanity. And so let us make tonight's event a clarion call for the justice that we need in order to live full lives as humans, full, healthy lives. So thank you.
All right. Thank you so much. Michael Lighty, Healthy California Now. Appreciate those words, and looking forward to more conversation with you. Yeah, give it up for Michael. That was fire. All right, awesome. Okay. Speaking of fire, I would like to introduce Michael. Mentioned Rose a little earlier. They go way back. We're so excited to have Rose Roach here, all the way from Minnesota. It's a little later over there. She's the chair of Healthcare for All Minnesota and the national organizer for Labor Campaign for Single Payer. Rose Roach.
Wow, thank you so very much. Good evening, everyone, and greetings of health and solidarity from the Labor Campaign for Single Payer. Thanks for having me here tonight. I just want to add that I spent 34 years in the labor movement. I retired in 2023 after representing both public school employees and the mighty nurses of the Minnesota Nurses Association, where I retired from as their executive director. So I am so very pleased to be here. I want to take Michael's really extremely important history and 10,000-foot level perspective on really the complicated relationship between labor and healthcare, and bring it down to the workplace, to the street, to the one-on-one organizing level. As the national coordinator for the Labor Campaign for Single Payer, I'm often asked, how do we get more unions involved in our campaign to win single payer? That is an extremely difficult and complicated but very valid question. And I'm going to focus my remarks on sort of trying to answer that as best I can. You know, we don't, unfortunately, I guess, have a monolithic labor movement in this country. So it's unlikely that every union is going to be on board with moving to a universal guaranteed healthcare system for all that doesn't involve health insurance and negotiation of that as some kind of a benefit, right? But that doesn't mean we shouldn't bring them to the table. We should, and we must. All stakeholders need to be in the room. We'll never get the fundamental change, as Michael said, that we need in this fragmented, complex, costly, and very dangerous system without labor helping to lead that campaign. But we should understand that not every union may be supportive, and that doesn't mean we don't continue to march forward. Although the Labor Campaign for Single Payer doesn't necessarily take positions on state bills, we support getting this done however and wherever we can. We do offer some guidance. 10 things that should be addressed when considering state single payer legislation to ensure that labor is not only at the table, but is helping to draft that state legislation. So I want to just list those 10 things. We'll make sure you get copies of all of this as well if you've attended tonight, so you have those handy if you need them. Number one, a demonstration of net savings for both employers, payroll tax plus employer contribution, and employees, any applicable payroll tax, premium sharing, co-pays, and deductibles. The economics drive a lot of this, right? For collectively bargained plans, a requirement that the parties must renegotiate those contribution rates to ensure that all of the savings that accrue equitably to the workers in the form of increased wages or benefits. We have seen huge wage stagnation due to this issue. That has to stop. An implicit recognition that multi-employer plans can continue to provide wraparound coverage for any benefits that are not provided by the state plan. Number four, the ability to negotiate employer payment of any employer or employee payroll tax obligation. If they're paying 100% right now, let's get them to keep paying 100%. They'll actually still be better off under single payer than what they're paying right now, without a doubt. Number five, a dedicated funding system that does not subject workers' benefits to the vagaries of an annual legislative budget fight. That's really important. Six, a clear role for plan-sponsored clinics and other direct providers of care. We know they're there are unions who actually are able to have plan-sponsored clinics. That's a good thing. We can continue that even in a single payer system. Seamless integration with Medicare, especially Part B, for retirees who reside either in state or out of state or who may move at some point in time. 8, a delivery system reform that allows the state to effectively manage the total cost of care within its borders. Number 9, an understanding of how care and funding is coordinated for individuals living in one state and working in another. We know that that is something that happens, right? And then finally, methods to resolve the complications from cross-border issues. Many trust funds in particular have developed very sophisticated mechanisms for coordinating coverage for those traveler workers who may work on a temporary basis, both for out-of-state residents working temporarily in a state and for state residents that are actually working out of state temporarily. They will not want to lose anything in the transition, and we need to make sure that that is protected. Trade unionists must also be involved in setting the terms of the debate that's related to those workers who will lose their jobs due to this implementation of a new system. We do that through a robust just transition section in the bill that includes wage and benefit replacement for a specified number of years, pension fund guarantees, educational benefits that include college tuition, and job creation job guarantees. We cannot leave any worker behind in a worse position due to this very necessary and important systemic change. We're trade unionists. We have to care about that. When approaching unions, I want to say that, you have to be kind of careful how you sort of, use a narrative on this. Don't say, we wrote this great bill and we want your endorsement. Think about instead approaching and saying, what do we need to include in the bill to ensure that your concerns are addressed? Doesn't mean we're going to be able to address them all necessarily, but again, you want those voices heard and make sure that everybody feels included. Find common ground wherever it's possible. Learn to speak their language and understand the concerns that unions have. Understand and address the institutional considerations that may affect a union's position. Another example might be saying, once we pass this great bill, there'll be no need for your union health and welfare fund. Not probably a good idea to approach it from that perspective. Say something like, what new union advantage benefits could your fund offer if it didn't have to spend every penny that you negotiate on basic health and dental benefits? Right? Lots of issues for us in labor to be negotiating, especially in this time. Lecturing doesn't work, as we know. It's about building relationship. It's organizing 101, show up at their events, get on their picket lines, make sure that we're working in building relationship with one another. I want to share a quote. I think some of you have already heard or seen this video, but New York State Senator Gustavo Rivera, he's the author of the New York Health Act, New York State's-based single payer bill. And when he was talking to labor, he said this, and I think this is really good framing and messaging. It's important to recognize the fight for healthcare that unions have been engaged in for their members for decades. Unions set the standard on health benefits, and they deserve major kudos for doing so. But single payer doesn't take away from that. It expands coverage to dental, hearing, vision, pharmaceutical, and long-term care for everyone, including all union members. Single payer doesn't take healthcare away from unions. It takes healthcare back from health insurance companies. Even good union insurance plans are struggling with narrowing networks and increased costs. Labor gets more with single payer, not less. When we take healthcare off the bargaining table, it means better wages and other benefits that are now foregone due to the focus on trying to negotiate healthcare benefits. There is no doubt that the next big fight is healthcare. Unions have fought for healthcare. Now it's time for unions to fight together to make it universal. This current system is unsustainable for all of us. Workers are going to see some of the highest premium increases they've seen in decades coming up here in this next year. And because of that, I am telling you, change is coming to the United States healthcare system. That's why it's important that the labor movement be prepared to shape that change to serve their members and all working people. A $10,000 raise for the working class is possible. Just remove the beast that is for-profit health insurance premiums, and we can put real dollars back in the pockets of workers. It is time to call the question, my friends. Is healthcare a negotiable benefit or is it a human necessity? Tying healthcare access, as we have been saying here, to employment is a failed strategy and makes zero economic or humanitarian sense. Our access to healthcare, as Lou said earlier, has become a weapon in the class warfare that we are all engaged in this country. And it is the greatest transfer of our wealth as workers to the corporate oligarch class. No more tweaking. We will never privately subsidize with public tax dollars our way to universal comprehensive health care. We need a disruptive solution. We need single payer because healthcare is in fact a human necessity, and therefore single payer universal system is the ultimate act of solidarity amongst all of us. Trade unionists must work to make healthcare for all politically possible by moving away from these resolutionary politics and move on to revolutionary politics, moving from transactional representation to transformational change. And we do that by building class solidarity through a powerful worker, patient, provider, people-centered campaign. Because as the grasshopper in the movie A Bug's Life once said, I know, crazy, but get this, you let one ant stand up to us and they all might stand up to us. Those puny little ants outnumber us 100 to 1. And if they ever figure that out, there goes our way of life. Well, no one has figured that out better than the labor movement. It is time to amplify it to better our way of life by guaranteeing health care for all. Si se puede, everyone.
Yeah. Whoa. Wow. My computer's hot. It's just like that's. Thank you, Rose. That was awesome. That was all kinds of fun here.
Dick Gottfried, I'm Barbara Harrison. I know Lou Sinniger. I used to work with him when I lived in Oregon. I miss being there. But Dick Gottfried is the person who wrote the New York Health Act way back in 1991. And he was on a call with us yesterday. And we still got work to do.
Yeah, I know, but Dick, I know Dick too. But I thought that Senator Gustavo, the new Kerry, he's carrying it on now. I thought he did a really good job in addressing labor's concerns.
It's the assembly we need, but I don't think Hochul will sign the bill. We need to get Antonio Delgado into that. He's a single payer person, but we need the unions. We need to say, if you will support single payer, you will get wage increases. That's what we need. So we've been talking about that. I just sent your organization to a couple of organizations in Texas and in New York. So thank you so much for doing this.
Thank you, Barbara. You're firing up everybody, Rose. Barbara's fired up. Who all here's fired up? I'm seeing the fire and the emojis in your hands. Well, speaking of fire, we're going to go on next because now we've got an awesome fiery educator here. His name is Todd Farris, middle school by day, union advocate all the time. Todd Farris.
Hey, yeah, thanks for having me, everybody. So we're actually, I like to frame this as we're in the middle of Oregon's largest collective bargaining event right now. And we have some union members at the table, and we need everybody to be here. This is a big collective bargaining agreement. I'm going to ask you to think big, and Rose and our other speakers have already talked about this big thinking. But unions are in a position right now to exert influence like we did back in the day when unions had national power. I'm talking about like unions won the 40-hour work week. We won weekends. We won paid medical leave. Unions got clean water and clean air regulations into federal law. And today is a day that we can have that dramatic impact again, because we can bring universal health care to Oregon and open the floodgates towards bringing universal health care to the United States. That's a big thought, and I think that's actually happening. It's starting in Oregon, and it's going to end in every state in the union. So universal health care means everybody in, nobody out. We're talking about no premiums, no copays, no deductibles. Um, or someone mentioned earlier that bankruptcies in America are caused by medical debt. It's like 50% of bankruptcies in America are caused by medical debt. No more medical debt bankruptcies in Oregon. And you can still choose your doctor and you get quality care. Like these are all things the planning board is making sure is going to happen. And that alone should inspire every union in Oregon to stand up and put all of their political and legislative powers. We all have PACs, we all have LAC teams. These need to be turned to face healthcare, you guys, because I'm going to give you a whole bunch of reasons why that you didn't think about right now. And normally I would spend the rest of my time like talking about why healthcare is so great. But a couple weeks ago, October 10th, the Universal Health Plan Governance Board released their first financial plan. And it is a total game changer. So I'm going to spend the rest of my time talking about actual dollar projections for Oregon for the impact that's going to have on us. And it could be this good around the country if we do this. So let me start with me. I'm a teacher. Through my collective bargaining agreement, my school district has allocated a mind-boggling $24,000 a year to cover my health insurance, and I still pay premiums, deductibles, and copays. It's ridiculous. And then Kaiser Permanente, did you guys hear this? Like they're expecting a 12% increase next year. It's not stopping. It is insane. The great news is, though, we have this budget that was released, and I'm going to share with you now the implications for people like me, a school teacher. K-12 education in Oregon stands to save 1.3 billion. I'm not saying million, I'm saying billion annually if we implement this universal health care plan. How much is that? Like, that's a lot of money. What does that mean? K-12 education currently receives an $11.4 billion budget. That's for all K-12 education in Oregon. This is like 10% of that budget that's going to be released. This is the biggest release of funds back to K-12 education in Oregon's history, right? That's amazing. So what could we do with that? Like, just to get really concrete, we could give a 10% pay raise for every union member involved in K-12 education, from janitors to secretaries to teachers, everybody. And that right there is headline news. No deductibles, no copays, no premiums, and a 10% raise for everybody. Okay, can we not see how this is like the best collective bargaining agreement? No one has got a collective bargaining agreement that has awarded that, right? And we could do this if we pass healthcare. But here's the thing. That's not all the money. There's a bunch of money left over. Let's see. So I think that ends up being about half. So we could also, okay, imagine this. We could reduce class sizes by 30% in schools. I'm a teacher, and like it almost makes me cry to think of how that would transform the lives of kids at no additional cost. This would just be about implementing universal health care and releasing funds. So it's right there, like universal health care, transforming education, schools, teachers. That is enough reason, right? Union leaders out there, do you hear like the powerful impact that this can do? We need you. We need to work with you. And it's like hard to get people to come and hear this. This is our collective bargaining agreement. We need everybody at the table. And now here's the funny thing. I've only talked about teachers, and teachers are only in education. We're only 20% of local government. There are so many other unions across the state. So let me just expand it a little bit. I saw some SEIU members on the call. Okay, and I think you're 70,000 strong in Oregon. You have very similar healthcare contracts like educators do. And so what could we do for you? Well, we could very easily offer you a 10% pay raise for every SEIU member, and that would only spend half the money. So what if we also, that would leave, like, let's say it left 500 million. The numbers are still a little rough. 500 million though, that's a little bit of money. Maybe we could put some of that towards affordable housing, maybe some mental health care, maybe some addiction specialist, or whatever we need to do to make Oregon great. Like, I don't think people understand that implementing universal health care can transform our state in so many ways. And if that were all All those things right there, is that not reason enough to do this? But you guys, we've only been talking about 3 unions: OEA, OSEA, and SEIU, right? And by the way, if any of those leaders are here at this call, call me. I want to talk to you, okay? But the fact is that every other union in Oregon stands to accrue a similar level of savings. If universal health care passes, I mean, what if we could bring 10% salary increases to every union in Oregon, the biggest one-time boost to the middle class salaries in Oregon's history? This is like a game changer, okay? But I'm going to stop right there with my enthusiasm. I could go on and on about the numbers. I got spreadsheets here like crazy, because this will not happen by itself. Unions, you need to unite for universal health care. We need to stand together behind the biggest collective bargaining agreement altogether. We need to face the same direction and make it happen. And then, like Rose was saying, as soon as we do, we also need to go back to our employers and make sure that that money that is released from this implementation comes back to us, because we, the workers, have negotiated these compensation packages, and just because it costs less doesn't mean we lose the resources that we negotiated. And so that's got to happen. Okay, so speak to your union members, speak to your leadership, please, everyone on this call, even nationally. And I want to talk to you. This is our opportunity to make historic change that will be recorded in history books as the start of the national wave that brought universal health care to the entire United States. It's starting here in Oregon, and everybody on this call, you're a part of this. So let's make it happen. Reach out to HCAO to find out how we can coordinate. Reach out to me personally, Todd Farris at HCAO. And then also, one more thing. Plan to bring yourself and 100 of your union brothers and sisters, all of your leadership, to Unions United for Universal Health Care, a rally we're going to do October 2026. And when we show we can bring a couple thousand people there, we're going to make sure Bernie comes just as a little icing on the cake and speaks for us. Unions United, let's go!
All right, let's go, Todd Farris. Thank you, Todd. That was awesome. Love that. Those kind of numbers are mind-boggling, because your mind just starts running around, just imagining the future we all could have. So thank you so much, Todd. All right, you've heard from the teacher. Now let's hear from a nurse. We've got an awesome nurse up next, Kaleigh Roehl, who is not only a bedside nurse, a union steward, but also leading work with Portland chapter of DSA's Family Agenda campaign. Kaleigh Roehl.
Thank you, Valdez. Yes, as he mentioned earlier, I'm a registered nurse here in Portland, Oregon. I'm the chief steward of my union in Oregon Nurses Association, and I'm the co-chair for the Family Agenda campaign of Portland Democratic Socialists of America. I'm so grateful for this opportunity to speak on this topic that I feel so passionately about, and I can tell that you all feel just as passionately, so that's fantastic. I've worked as a nurse for almost 13 years. In that time, I have seen the truly devastating impact our current for-profit healthcare system has had on our communities. I have seen very sick patients who need immediate care refuse an ambulance ride for fear they will not be able to cover the cost. I have watched patients leave the hospital AMA, or against medical advice, because they won't be able to afford the bill. I have watched families spend countless hours over the phone arguing with insurance companies over what they will or will not cover while their loved one lays in a hospital bed next to them dying. Unfortunately, these scenarios are all too common in this country, and it does not have to be this way. If you're like me, you believe that healthcare is a basic human right that should not be conditional on somebody's ability to pay, citizenship, or their employment status. The working class in all fields across Oregon and our country would benefit greatly from moving to single-payer universal healthcare, and this is especially true for those of us in unions. Healthcare benefits are a huge topic of discussion at bargaining tables during contract negotiations. Removing this table off the bargaining table would mean we could focus our efforts on other areas such as wages, paid time off, retirement, or safe staffing, especially as hospitals continue to make reductions to increase their profit margins. Universal healthcare would also have a major impact when it comes to building worker power through striking. As some of you may know, almost 5,000 healthcare workers from across the Providence healthcare system went on strike earlier this year. Our open-ended strike lasted 46 days and was deeply impacted by the fact that our healthcare is tied to our employment. For starters, many nurses were faced with a very tough decision: walk out and risk our employer taking away our healthcare benefits from us and our families, or cross the picket line and work through the duration of the strike. Some nurses wanted desperately to stand in solidarity with their fellow worker on the line, but they were about to give birth, for example, and were afraid they would lose coverage, so they crossed the line. As the strike went on, our employer callously threatened to cut off our health insurance if we did not return to work. Employers should absolutely not have this kind of power over their employees and their families. The fact that an employer can hold an employee hostage by restricting affordable access to care or medications is immoral. Nurses were truly scared when they decided to make this threat, myself included. Many of us had already gone several weeks without a paycheck and knew we could not afford the astronomical cost of COBRA if we needed to seek care. This threat ultimately affected our leverage by intimidating more nurses to cross the picket line and begin returning to work. We ended up voting yes on the next tentative agreement presented to us, even though many nurses I've spoken to felt that they would not have if they weren't staring down the barrel of losing their coverage. We all know that our current healthcare system is broken, and the repeated attempts at fixing it fall completely short of making any meaningful impact for working families. We have very successful models of single-payer healthcare systems in other countries around the world, but we choose to allow for-profit corporations to continue exploiting the lives of our community members. However, pointing out the problems with our current system is only the first step. We must all take it several steps further and work to make single-payer healthcare a reality. Providing the working class with healthcare means that unions will have more leverage when standing up to their employers and will continue shifting the power over to workers where it belongs. And, you know, as we say in DSA, a better world is possible. And a better world for the working class means healthcare for all. Thank you, and solidarity forever.
All right, solidarity forever. Give it up for Kaleigh Roehl. All right, thank you so much. What a great, was that a great lineup of speakers or what? Okay, there's sometimes not a lot to be hopeful about in this these times, but I don't know about you, but I'm feeling hopeful right now. So we're gonna move to the Q&A portion. I'm gonna go to my friend Randy, not in Union County first, because he's dropped a question in the chat. But please do use your hand raise function at the bottom there. How do you do it? You basically click on the little react button. It looks like a little heart, and it says react in the bottom middle of your screen. I don't know about the phones. I'm doing the desktop thing. And then you can hit the raise hand button. And then I will call on you in order, but I do want to prioritize folks like Jason from SEIU 503. But first off, Randy, are you able to come off mute and ask your question? Randy, got your ears on? Okay, I'm going to read Randy's question here. Basically, let me go back to it because he posted it a few times here. Just going to ask a question here. With approximately, and all panelists, any one of you that wants to take this one on, with approximately 1,400 Taft-Hartley multi-employer pension plans in the U.S. covering roughly 10 million participants and another roughly 1,261 multi-employer health and welfare plans covering about 4.7 million members, how, without federal legislation, can states make a universal health care plan available to these members? From Randy, who is a retired WIUNA 51-year member. Anyone want to take that one on?
Yeah, I mean, I can give it a try. Michael
Okay.
can probably also add some thoughts to this. So, really, really valuable question. It's really an important question, Randy. So, thanks for putting it out there because this has really, quite frankly, been one of the major sort of hurdles, right, inside of the labor movement, is because, in particularly in the building trades, and I know you're a LIUNA retiree, you guys fought for a long, long time and established these Taft-Hartley trusts, and that has become a really important part of your union. It's become a very important part of organizing members into the union, and it has become an important benefit that you obviously negotiate at the bargaining table on behalf of your members. So I'm going to take a stab at this at the state level. I'm going to speak sort of more with my hat as the chair of Healthcare for All Minnesota, because we're thinking deeply about that in regards to our state bill as we're trying to figure out how to put this together. So it's my understanding that states have the right to tax. That you're right, the state government can tax individuals, they can tax businesses, right? And so if you're going to do a single payer plan, and different states are thinking about this differently. So I'm not saying this is the only possible way to do this. But here in Minnesota, the way we're thinking about it is this. I think what you're referring to probably is like ERISA. And ERISA is the, federal legislation that oversees health plans and employers being able to provide health insurance and other things as well, covers, employee benefits. So here's how we're thinking about this. If the state government passes a single payer plan, and the way that they are going to fund that plan is to say, we're going to tax employers X amount, whatever that is, and we're going to tax employees Y amount. Everybody is going to get hit with that. So the employees and employers inside of your Taft-Hartley Trust Fund, they're going to pay that tax. So the question really becomes now, can we force you to stop providing private insurance? Probably not, because of that federal law. So it's a valid issue for you to have raised this, right? Probably can't force you, but it'll come down to the economics. If you're already paying the tax for all your members to have access to the state plan that's going to cover everybody, isn't going to have deductibles, everything is in network, isn't going to have co-pays, why economically would you also buy private health insurance for them? It's not probably going to make a lot of economic sense. It's still going to be negotiable, though. You're absolutely right about that it is going to be something that everybody is going to have to deal with at the bargaining table, particularly in Taft-Hartley Trust. But that's how we're thinking about it here. I mean, it's a big employer that's self-insured may do the same thing, may say, we don't want to, put our employees in the state plan. We're not going to be able to override ERISA without federal legislation allowing us to, and that's why we support the state-based Universal Health Act, right, is because it would give us waivers to override ERISA and be able to put everybody into the state plan. But until that happens, if a state passes it before those waivers become automatic and we don't get the federal government to grant those waivers, technically they're going to be able to still provide some level of private insurance, but I don't know economically why any employer would do that. They're going to get hit twice, right? They're going to buy private insurance and they're going to pay the tax. I think they're going to, at the end of the day, going to see that it makes more sense to put everybody into that state plan. It's why we should really do this on a national level versus the state. But I get it. The states might have to innovate and be the first ones to actually make the move on this. Michael, would you add anything? I'm not sure if I put that out there right.
Well, you definitely, I'm not going to correct you. You got it right. I would add that this is why we meet with Taft-Hartley Trust trustees from the union side, right? And this gets very complicated. You start talking to the entertainment industry unions who have these Taft-Hartley trusts that are funded in part by residuals. So you're like, oh, okay. So how do you integrate that? But the trustees can make the decision to say, okay, we're no longer going to collect this premium from employers. And instead, we're going to take the residuals, or we're going to take some kind of fee, and we're going to provide those supplemental benefits that you described, right, Rose? And so they can make that decision, you know, it's not even just up to the employers. The trustees themselves can do it, right? And so that's why it's so important in our organizing to talk with union trustees and say, this is a better deal for your members. You're not going to have 10%, maybe 20% premium increases each year. You're not going to be faced with that question of, oh, do I have to cut benefits or raise raise what we pay to the insurers and take that money away from workers. I mean, we're basically in a situation, right, where same for the trust funds as everybody else. Are we just going to transfer wealth from the employers to the insurance companies, bypassing workers, right? That's the system we got. That's the bargaining we do, right? And the trustees could make, I think, and likely will make a very rational decision like, nah, we can do better. And this is a better way. And I think what Todd laid out is exactly the economics of why it's better in Oregon.
Awesome. All right. Thank you so much. That was a very big question. We do have about 5 questions in the queue, so we're going to move on to the next one. Jason from SEIU 503, take it away. And let's see if I can. There you go. I've asked you to unmute. I don't know if it's letting you. There you go.
All right, can you hear me?
Loud and clear.
Okay, so my question kind of goes back to roads. So I've been working a lot with Lou. I'm in Cottage Grove, not too far from Eugene, and working with Lou and Hannah to do events. And I have a big event coming up this weekend. I'm a photographer and also have a show for my photography, but I got sent a whole entire package, you can kind of see here, of all that stuff. I was wondering if Rose or somebody would be able to send me that speech that she read, the one that got everyone fired up, so I can have a little bit of, I guess, ammo to be able to converse with people when I'm getting asked questions or to talk about some of those things.
Absolutely. I actually have a email ready to go out right after this is done to Valdez, so he can share my comments tonight and my remarks with all of you. Anybody who wants them, I'm happy to share them.
Thank you, Rose. Rose is the gift that keeps on giving. Go ahead.
Yeah, excellent. Yeah, and yeah, that was it for now. I'm just happy to be here.
Awesome. And if you're an on-the-ground organizer, wherever you are at, we'll have a little share some opportunities at the end here, but you can get one of those care packages from the office like Jason got there. All right, next up is Karen. Is it Karen Ashika? Am I pronouncing that correct?
Yes, and I'm sorry, my camera's not working. Can you hear me okay?
We can hear you loud and clear. What's your thought or question?
My comment is about something that I think one of your last speakers mentioned, that there's money that moves between corporations and insurance companies, and how that money moves from workers' paychecks through corporations to insurance companies varies according to the company. And sometimes they, like United Healthcare, for example, they have networks of providers that and recently have bought medical providing systems, but they don't actually pay money. That money goes to the employers. They take care of the billing and the claims, getting the money back from the employers. But there's great incentives to have that money held by the employer for even a day before the payouts happen. And that leads to a lot of denials, because if you could delay that money. So that needs to be addressed when you're putting these plans together, because employers may not be, they might be depending on that money to pay their salaries, to invest in things that they want to invest in. And it's not, most people don't really realize how many insurance companies do that, but some of the major ones do. And I've worked in insurance industry before my retirement for decades. And
Karen, I just want to see if you have a question, just because I have a few more questions. And we only have about 11 more minutes.
Yeah. Anyway, if anybody is addressing that issue in their negotiations and in their planning, how do corporations, large corporations, feel about what this plan will do? Because it will remove the claims money from them.
Any responses to that one, panelists? That was kind of a.
Oh, well, I'll take a stab at it if no one else wants to. I mean, it's true that insurance companies actually derive a huge portion of their revenues and profits from investment and from holding money. And many corporations are in turn invested in those insurance companies. So that's kind of one thing, is that the insurance companies are actually a kind of pillar for the broader capitalist system, corporate capitalist system. And it's also true that the self-insured employers, as Karen was saying, will use the money that they charge workers for healthcare and hold on to it. And if they don't have to pay claims, or if they can delay paying claims for 30 days to the provider, that's money they can invest. That's exactly right. So we have to understand that this health insurance system is part of Wall Street, is part of the financial system. And the same people, they sit on each other's boards. You wonder, like, well, geez, single payer makes so much sense for business. I mean, these auto, companies in the US pay what, $1,500 more a car than they do in Canada, because Canada has a Medicare for all type system. Why don't they just do it? Well, it turns out there are all these other financial transaction connections that the employers benefit from, and also feel like, well, yeah, we're kind of in the same group here. These are our friends. These are our, our capitalist crony buddies. We can't turn on them, because if we let people take over their business, well, are they going to come for ours? So there are all sorts of kind of financial and ideological barriers there on the corporate side. This is going to have to be won. We have to understand this by a movement led by labor that overcomes those corporate financial connections. And the same pillars of the oligarchy are some of the pillars we have to take out in order to win this Medicare for all single payer.
Thank you, Michael. I'm going to read the next question, which is from Kim. And I think this might be good for Rose and maybe Todd. For public employees, won't government allocations to public funds like education be actually less if the state is paying for healthcare? If that happens, public employees don't really have a benefit change. Is that correct?
Well, I'm happy to start it out, Todd, if that's okay. I mean, the answer to that's no, because this is going to be a new fund. It's going to be, when I worked in California for 11 years with Michael out there, I was with CSEA, he was with CNA, NNU, but we did a lot of overlap on healthcare work. And of course, in California, you have Prop 98, where, 40% of all taxes have to go to the schools. And so there was this real concern about, wait a minute, if we raise a tax for healthcare, 40% of it automatically has to go into the schools because of Prop 98. But the idea is that you have to set up a healthcare trust fund, just similar to Medicare. It's no different than that. I mean, it's going to be, this is the tax. It is a health access or a health fund or whatever you want to call it, tax, whatever the name of your particular state plan is. It's going into a lockbox, just like Social Security and Medicare. And that's where that money is going to stay, and it's only going to be used for healthcare. We want to keep funding public schools. There's no question about that. There's no reason we can't keep doing that with the taxes that we're already bringing in and funding those schools with. If we need to raise taxes for that, then we raise taxes for that. But the healthcare tax would be specific and would be used specifically just for healthcare. At least that's how we're thinking about it again here in Minnesota, and that's what most of the states that I've heard from are thinking about doing with their healthcare tax to fund their system. Todd, any other thoughts on?
Yeah, I would
Todd,
just
and then a comment from Mike after Todd, and then we'll go to Mary Lou's question. Go ahead, Todd.
I think I would just add that so the Oregon's current plan is to set up a completely independent fund that is only for healthcare. And currently, all these organizations, including government ones, get their budget and then pay into that. And so they would just pay less into that, right? Because it's basically planned to be a tax, and the government, they're the employer paid side. So just by charging less, all these entities will have more money. So that's that one side that's answered. And then the other side is the money they do collect will go into that bucket. And I think ultimately the cost is just going to be so much less. There's going to be a lot more money out there.
Agreed, 100%, Todd. Mike, did you have a comment or on that thread of thinking? Mike from SEIU 503.
It's in a separate thread, separate question. So if you
Okay,
want,
separate question. All right, Mary Lou, you've got the con next. We might be able to get one. We might be able to get Mike's question in. So it's you, then On God, then Mike. Go ahead, Mary Lou.
I was just going to say that I'm on this Universal Health Plan Governing Board, and I'm one of the 8 members now. And I'm on the Finance and Revenue Committee. So this whole issue of the taxation, how we're going to pay for it, and exactly as Michael and Rose have said, it will be a separate fund. It will be a dedicated tax. We have this crazy thing called the Oregon kicker that drives all of us nuts, but this will be exempt from the kicker because it will be into this public trust fund that the public corporation in Oregon, we have a public corporation that does SAFE, State Accident Industrial Fund, and it'll be similar to something like that. But anyway, and I think that the calculations that Todd's talking about, are still preliminary. However, there will be tremendous savings. And on the Taft-Hartley thing and the ERISA, our plan will not be to say that they can't do what they want to do. But the fact is that I think, as Rose said, the economics of it will be like, why, if they're getting this great, and right now our plan has state employee benefits as the basis, along with some added behavioral health things that are in the Oregon Health Plan Medicaid here. So we're calling it PEB Plus. So it's a really thick plan. And, why would any employer really want to be, or a union be paying for another one that when they automatically are enrolled in the state one? So anyway, but those issues definitely are ones that we're considering. And there are some naughty ones that we don't have all the answers yet, but Universal Health Plan Governing Board, you can take a look and watch our meetings and watch our committees, and it's all done there in the public.
Thank you, Mary Lou. Our last 2 minutes, I do have some call to action. So I just want to get these last questions and includes a link to get involved with the governance board, because we do want to build a plan now, like Rose said. On God had a question. Kaleigh, I think it might be best for you. Any thoughts about about malpractice insurance and malpractice claims, and any thoughts related to that one? I mean, it's kind of more on the physician side, but do you ever hear your clinical buddies talking about that one?
Not as much, luckily. I think that's probably a good thing. But yeah, I don't hear a ton about that. I did see another question in the chat about the number of healthcare professionals potentially as well.
Does that attract people here?
Yeah, I think so. Like we see, I know I saw somebody talk about the very successful recruiting campaign that they're doing for in Canada to get folks to come up there and work there. But this system would likely mean that more people would be seeking care. And so there would probably be an increased need for healthcare professionals, more than likely. And I know that there's this thought that there's like a really big healthcare worker shortage, and it's less about healthcare shortage and more about honestly the working conditions for healthcare providers. And so I think we will see probably an increased demand for healthcare providers, and also things will just sort of shift, right? Like folks won't likely use the emergency room for primary care as much as they do now. And so a lot of that care will likely shift over to more like primary care type settings. And so I'm sure that it will be an adjustment. But I think we've got tons of people that would want to work in the healthcare system, as long as they're being paid adequately and respected. So yeah, I think it would be an adjustment period, but that's just like most things, right?
Thank you for your inside view from the clinical space. I'm a healthcare admin guy, but I 100% agree with you. I think those would be the benefits and the effects. Mike, I'm going to give you the last quick question, and then we're going to do our call to action and wrap up. Mike Powers, 503.
Yeah. My question is, has HCAO healthcare, have you approached labor in Oregon to try to form a coalition especially as the board coalesces a plan?
Yes, and I'm going to let Lou speak to that one.
Oh, thank you.
Like that,
Yes,
Lou?
we have reached out. Yes, we have. And we have a union caucus meeting every second Wednesday of the month. We have reached out that way. We are making an impact on the Universal Health Plan Governance Board, but we really, to put it bluntly, we should have a meeting with the leading unions in this state to put together a plan. Does that answer your question?
And 100%, Lou. And also, Mike, I'll say, like, we do reach out, for these, like, personalized invitations, and spreading the word and the opportunity. ONA has been a huge supporter as one of our big sponsors at HCAO. Joe Basler and AFSCME, huge support. AFT has been a supporter. So we definitely have relationships with with our union friends. But again, you're exactly right. We do need to be having those enhanced conversations and bring it to the table, because we don't want this plan to get cooked and built and served unless it's meeting the needs of unions and working families. So on that note, I'm going to go ahead and bring us home here. Thank you all again for coming to this awesome event. Yeah, thanks, Mike. That was great. I want to thank you all for attending again. It wouldn't be a great meeting without a call to action. So I have a few actions for you to consider. And my friends from HCAO are going to be dropping some links here in the chat. So first off, what can you do? Please go to www.hcao.org and join the movement if you have not already. Just by adding your name to a statement of support helps add to our list of supporters and shows our strength and the popularity of this grassroots movement. You can also become a member for as little as $5 a month or $30 a year. We're 90% funded by individuals like yourselves, and every dollar goes towards our organizing and advocacy efforts. Let your union leadership know that you support universal healthcare. Union leaders need to know that the rank and file are behind this and are calling for more engagement and action at the top levels of the union. And yes, as president of HCAO, I will be reaching out to the top levels and having those conversations as well. You can tell your union to become a member. We have organizational membership privileges, and one of the team can drop a link to that. Make your voice heard at the Universal Health Plan Governance Board. They meet monthly. They've got 4 subcommittees that meet, or 4 committees that meet monthly. It's designing the plan as we speak, the Universal Health Plan Governance Board. You can Google it. There's only one in the world. The recommendations are going to be out next September 2026. And now is the time, before it's built, to make your voice heard and call on them to design a plan that is simplified, fair, and equitable. They're going to drop a link in the chat here for you to submit public testimony. It's simple and easy, and they want to hear from you. They do. Lou mentioned we have a labor caucus. Join our Healthcare for Oregon Labor Caucus. It's an exciting space for union members and advocates to gather, discuss, strategize, organize around this issue. If you're interested in joining, you can reach out to Claire Colmer, our awesome staff organizer, at office@hcao.org to find out more or sign up. Our next meeting is actually November 12th, Wednesday, November 12th at 7 p.m. And then you can get involved with Healthcare for Oregon. So whether you're interested in volunteering and organizing events or serving on the board, we welcome everything in between. Please visit our volunteer page on the website, and you can volunteer or email me directly at president@hcao.org if you're interested in getting involved at the highest levels of HCAO. And they're going to drop a link to volunteer. There's events from all over the state. Lastly, if you like this webinar, we have one a week from tonight on Tuesday, November 4th. I know that we'll maybe be watching some election news out of New York or something that night. But if you like, we have our November 4th Taiwanese Health System, National Healthcare System webinar a week from tonight, Tuesday, November 4th. It's a single payer design with universal healthcare for all. And, universal healthcare means that cost is not a barrier. Everyone can get true comprehensive care, universal healthcare. Single payer obviously means that there's one payer. In Oregon, we are kind of pushing for a single payer where the state is that single payer. So there is a little bit of a nuance there. But there will be a veterans themed event as well on Wednesday, November 12th. Both are available on our HCAO calendar for free registration. So come learn from public health experts and current deputy minister of the National Taiwanese Health and Insurance Administration on November 4th. Come from here, Dan Shea, Veterans for Peace, Betsy Zucker from Jobs with Justice, and Suzanne Gordon, who is fighting the privatization of the VA at our veteran theme event on November 12th. So thank you again for joining and making this just such a wonderful conversation. And stay tuned, look at our events calendar for more information about future HCAO events. We really appreciate you dialing in tonight. Hope you get involved with the movement if you're not already. Thanks, everybody.
Hi, Lou. So good to see you. I have to say, it's so
good to see you too, Barbara. Hang in there in New York.
Ay vey.
Move out here and get better health care.
I'd rather be out in Oregon with you guys.